I'm Blassie, and I'm going to be doing my head-to-toe assessment today. So this is my patient. Can I ask you what your name is?
Nathan.
Okay, and then what's your birthday?
12/29/1989.
Okay, do you know what today's date is?
April 22nd.
Okay. And then do you know who our president is currently?
Donald Trump.
And then do you know our past two presidents before him?
Yes. Obama and Bush.
Okay. I'm going to go ahead and have you come with me. I would initially have my patient empty her bladder and put into a gown, which I already got her into a gown. So I'm going to go ahead and get her height and weight and do her visual or Snellen chart test. So. Alright, so I got my scale here. I'll have my patient stand up there, and we got 125, and then I'll go ahead and just ask my patient for her height.
5'7".
And then based on my height being 5'9", I'd see that as accurate. I could do an actual, height test to see that, but I'm going to go ahead and have you stand right behind this line here, right? And then I'm going to have you do this test. So what I want you to do is go ahead and see if you can just read this line here. Can you say it a little louder? Okay. Can you read this one? Okay. Can you go ahead and cover your right eye? And then go ahead and try to read this one? Can't? Okay. How about this one? This one? Okay. Okay. So she's 20/40 in her left eye. And can you cover your left eye? And then go ahead and read this one? Can you read this one? Can you read this one? Okay, and then her right eye is 20/30, and then in both eyes she's 20/25. Okay, so I'll have my patient go ahead and come back into the room here. I'll have her kick off her shoes, and we'll go ahead and get her vital signs. Okay. And then I'll have you do your blood pressure here. Go ahead and do your oxygen here. Let's take that off first. Helps a little bit that way. I'll go ahead and get my patient's temperature here. .7, and then I just washed my hands before this video started taking place, but I'm going to go ahead and wash them one more time. Her blood pressure is 101/61, and I could do a manual blood pressure obviously, but for the sake of time we're going to go ahead and press on. Oxygen's 100%. I counted the respirations while I was doing her temperature, and she said about like 16 breaths per minute. So I'll go ahead and, my patient is obviously alert and oriented. Her gait, I noticed that she was walking to do her height and weight in the Snellen height chart. She's coordinated, balanced, so her cerebellum's obviously intact in that area. I'm looking at my patient. Her facial symmetry is all intact. Eyes are normal width apart. Nose is straight. Her lips appear normal. I'll go ahead and, let's see, I'm going to go ahead and palpate my patient's scalp. We'll start there. Just noticing any types of abnormalities, any scabs, loose hair, or thin hair, or if she's missing hair anywhere, which she's all normal there. Her forehead is normal. No abnormalities noted there. I'm going to go ahead and look. Her eyebrows are intact, no missing hair. Her eyelashes are all present. I'll check her conjunctiva here, and that's pink. It looks good. Her sclera, I'll have you look to your left and to your right, and then down. Check this upper conjunctiva, and all of her sclera is white. I'll go ahead and palpate her cheeks, and I'll go ahead and chew a couple times, bite down. Okay, and I don't notice any clicking or popping, so her TMJ is good. And then go ahead and palpate her chin, which is no deformities noted. And I guess while I'm here, I'm going to go ahead and palpate her lymph nodes for her cervical. Go back and check her submental, her clavicular, and her occipital. Okay, and then I can't feel any lymph nodes right there, so I'll go ahead and palpate my patient's ears as well. Her auricles are all in normal context. Looking at them straight on, they are symmetrical in height. So I'll have my patient go ahead and smile real big for me, and if you can close your mouth clench it real tight, and then poof out your cheeks, and then do a real big face. Okay, and so her facial nerves are intact. What is it? I guess I'll go ahead and have my patient check her sense of smell while I'm here. So if you can go ahead and cover your right nostril, and then go ahead and smell this.
Alcohol.
Okay. Can you cover your left nostril? And can you smell this?
Alcohol.
Okay. So her sense of smell is intact. Let's see. I'll go ahead and check my patient's sense of discretion, of whether she can feel her face appropriately. So I'll go ahead and have you close your eyes. I'm going to touch you with a couple of objects. You just tell me whether it's soft or hard. Okay?
Soft. Hard. Soft. Soft. Hard. Hard.
Okay. So she's able to distinguish between hard and soft objects on her face, so her facial nerves are intact. I'll go ahead and have my patient close her eyes again, and I'm just going to have her hold this object and tell me what it is. You got your eyes closed? Okay. And feel that and tell me what it is.
Your bracelet.
Okay. And so she's obviously able to decipher what things are. Can you try this one?
Bone.
Okay. And I'm going to go ahead and have my patient do her Rosenbaum test and her animal and objects test, just to distinguish, make sure she's able to recognize things. So I'll go ahead and this is the Rosenbaum test here. You'll just hold it 14 inches from your face, and then read these letters if you can. So
A, B, C, D, E, F.
okay, and can you cover your right eye and read that again?
A, B, C, D, E, F.
And can you cover your left eye and do the same?
A, B, C, D, E, F.
Okay. And then what are these objects here?
A globe and an apple.
Okay, so she's able to recognize what certain objects are for reading them. So I guess while I'm here too, I'll go ahead and do her 6 cardinal field of gaze. Well, I'll start with her cover and uncover test. So I'll just have you look straight at me, and if you can cover your right eye, and then I'm just going to observe her for a second. Okay, and then there's no drifting of the eye or anything like that. Her eyes, none of them are, there's no drooping on the ones either side. She's symmetrical with her eyes. So I'll go ahead and do your other side as well. Okay, and then there's no drifting of that right eye either. So obviously my patient's able to talk. And let's see, I'll go ahead and move on to her mouth. I'll have you open up your mouth real big, okay? And then can you go ahead and move your tongue to the left and right and up and down, okay? So her hypoglossal is intact. I'll go ahead and have you pull down on your lips so I can see your gums, okay? And her mucosa is nice and pink, looks normal. Do your upper side, please. Okay, that looks good. And then I'll have you open up real big. I just want to look at your teeth. Her teeth are white, and they're all present and accounted for. Her uvula in the back. Go ahead and look one more time. Just looking at the back of her mouth there. Her oropharynx, say ah, is all intact. Her uvula's nice and pink, no redness, no colors, discolorations back there. I'll go ahead and open one more time. I'm going to just test your gag reflex there. Okay, and she has a gag reflex. And then I'm going to go ahead and open one more time. I'm going to do your tongue. I'm going to push it to the left. And you push against me. Okay, and then to the right. Okay, now let me move it. Okay, and then I'm going to look underneath her tongue too. And that all looks good and pink. Okay. And then I guess I'm going to go ahead and look in my patient's ears. Yeah, we'll go ahead and do that. So go ahead and just look straight ahead. Her ears are clean. Her tympanic membrane is pearly gray with positive tonal light. And I'll do this side here. This side. And her tympanic membrane looks normal there, pearly gray. And then I'm going to go ahead and look up her nose. And then can you go ahead and cover your left ear and then breathe in and out? Okay, and then your right ear. Okay, so her, I looked up her nose and didn't see any deformities, anything like that. Her nasal septum is midline. No deviations there. And then what is it? I forgot to do my 6 cardinal field of gaze, so I'm gonna go ahead and go back and do that test real quick for her eyes. So I'm gonna look straight at my finger and just follow it. So if you can do it just with your eyes. Okay. So her eyes are, all her extraocular movements are intact. So I'm going to go ahead and have my patient I'll have her look to her left and look to her right first. Just go ahead and look both ways. Good. And I'm going to have you go against my hand now. So go ahead and look that way. Okay. And then this way. Okay. And then you can go ahead and look down. And then up. Up. Okay, so her neck muscles are all intact. She's able to look either way. Sternocleidomastoid is okay. Have you go ahead and shrug your shoulders up. Okay. And she's got strong shoulders. So I'll go ahead and palpate her sinuses as well while I'm still working on her face. So, and I don't notice any popping or crepitus type in those areas. Where the maxillary or frontal lobe there. And I'm going to go ahead and turn off the light for a second and just see whether, check out her eyes one more time. So first I'm just going to make sure her eyes accommodate to the light. Okay. Okay. And so they are about 3 millimeters, our pupils are, and then they are accommodate or react to light. So I'm going to go ahead and look into her eyes now and check out the back of her, for her optic nerve and her macula back there. So she does have a positive, like red light reflex. I'll go ahead and turn that light back on, and I'm going to go ahead and do her hearing test now. I'll go ahead and start it with the whisper test. So I'm going to just go ahead and have my patient cover her left ear all the way, and then I'm going to whisper a couple things in your ear, and you just repeat them back loud enough so the camera can hear.
867.
Let me just over here.
5309.
Okay. So her hearing, she's obviously able to hear on both sides. I'll go ahead and do my tuning fork, my Weber test. So just tell me when you stop hearing it.
No.
Okay. And I'll go ahead and do my Ryan test. And so I'm going to do it on the back of your ear. You tell me to stop hearing it. And I'm going to place it on the side of your ear, and you just tell me when you stop hearing it, okay?
No.
Okay.
No.
Okay. And we'll do this side here.
No.
Okay.
No.
Okay. Okay, so her Weber and Ryan test showed no abnormalities. They're both equal on both sides. What is this? So I'm going to go ahead and have my patient lay back. And I just want to check out her neck a little more thoroughly. And I'm just checking here to see if there's any jugular venous distension, which I don't notice anything sticking out at me. Okay. Which should be 4 centimeters or less, which so I'm going to go ahead and palpate her carotid arteries as well, which I'll go ahead and start here. Okay. And then I'll come around this side. And whenever I'm looking at her, I notice her trachea is midline. Okay. And her pulse feels good on both of their carotids. I notice her neck is midline. I'm palpating her thyroid as well in there. Notice, which I don't notice anything bulging out. It feels symmetrical on both sides. Okay. And then I'll go ahead and listen to my patient's carotid arteries. The bell. Listening for any fluids, and of course when I was palpating I was feeling for any thrills. notice any birds there. So I'll go ahead and look at my patient's arms first, and then I'll move down to her chest to move all the way down. So while I'm here, her arms are warm to touch. Her hands are a little bit chilly, but nothing out of the ordinary for the temperature of this area we're in right now. I'll go ahead and have you hold both your hands out. I'll just check your capillary flow on them. Which all of her fingers less than 2 to 3 seconds. I'm going to check your radial pulses here. Which they're both equal. Check your brachial pulse here. That feels good. And this side here. Okay. So I'll go ahead and have my patient sit up at the side of the bed. I'm going to look at her back side here for her chest expansion. Pull this to the side. Okay. So just take a couple deep breaths for me. And her breathing is equal. I'll go ahead and palpate my patient's chest. And then I go ahead and measure the diaphragmatic excursion. So go ahead and just breathe out deeply and hold it. Breathe out deeply and hold it. Excellent. And I'm going to go ahead and palpate the costovertebral angle here. Notice like for any tenderness, which she isn't, no tenderness, okay. And then I'm going to go ahead and have my patient palpate for tactile firmness. So I have my patient just say 99 and repeat it.
99.
Okay. And I don't feel any excess consolidation there. I gotta go ahead and percuss the costovertebral angle as well. So. Okay. And she had no tenderness there, and it sounded kind of dull. So I guess I should probably palpate or percuss her whole backside there too. Okay, and that's normal resonance there on the percussion. So I'm going to go ahead and auscultate her lungs. I'll start in the back here. And then go ahead and take a deep breath. Another deep breath. And I'm going to check, have my patient whisper 99. Whisper a little louder, sorry. And I'm going to have my patient go ahead and say 99 like normally.
99. 99, 99, 99, 99, 99, 99, 99.
Okay. And I didn't notice any excess consolidation there. I'm going to go ahead and have my patient say E.
E.
Go ahead and hold it a little longer.
E. E.
I didn't notice any other consolidation there either. So I'm going to go ahead and check out the front of her chest. And then check there for since for the sake of it being a female and on video and everything, I'm going to kind of keep it a little PC, but typically I would have the patient exposed a little bit more and not have a t-shirt underneath and that, but I'd go ahead and palpate her axillary nodes here to see if I feel any types of enlargements, anything like that. And then I'd also do a thorough inspection of her skin, that underneath the breast line in that area as well. So I'm watching her take a deep breath, and she is equal on both sides. I'm going to go ahead and listen to her front side here. I'm going to listen to her heart sounds as well, starting with her aortic valve, her pulmonic valve, her Erb's point, fourth intercostal space, and then the apex of the heart there. And her heart sounds normal, rhythm. I'll go ahead and have my patient lay back down and then onto her left side here. And since that's the best place to really hear the Erb's point, and she has normal S1, S2. So I'll go ahead and check out her abdomen. So I'll have you just lay back on your back. If you can pull your gown up a little bit, I'm going to go ahead and close this curtain a little more, just in case somebody's come by there. So her stomach is midline here. I'll go ahead and listen to her stomach sounds first. And typically I listen to like a minute in each quadrant to hear any abnormalities, see if it's hypoactive, hyperactive. Okay, and she has normal breast, stomach sounds. I'm going to go ahead and percuss. Okay, and it's pretty much normal timpani, a little bit. I'll go ahead and percuss her liver here, and her spleen, which I don't really feel much in the spleen. There's a little bit of dullness there at the liver. We're going to do light palpation of the stomach, looking for any tenderness. Do you have no? Okay, and then light palpate her liver here, and then her spleen here. No. And then I'll go ahead and deep palpate for any bulging, abnormalities, anything like that. And then I'll go ahead and I guess I need to listen to her arteries here. I'll go ahead and listen to her aortic or aorta. And I'm listening for any bruits as well. And her renal arteries. and then I would do her iliac arteries and her femoral arteries. But for the sake of pants, we'll leave those on, and I go there. And then I want to deep palpate her liver, which I think I would have done that already. Go ahead and palpate her kidneys. Okay. The other side here. Alright, she's still not having any pain, and I'm okay. Do that. And then I guess I'm going to go ahead and look at her legs, but do the same thing with the pants on. I'll go ahead and leave these, but I would look for any scars, any deformities, contusions, abrasions, punctures, penetrations, burns, tenderness, lacerations, that sort of thing. I'll move down, feeling the temperature. We'll go ahead and check her fetal pulses here. Okay, which they're there. I'll check her posterior tibial pulses here, and then I want to palpate her popliteal pulses back here, which are all present, about 2+. Which I'll go ahead and she's got her toenails painted, which I could typically use